Hey everyone, this is Jill at the AAFE Training Center, and today we're going to do a case of lifting threads. This patient is back for her annual lifting threads treatment. She gets them every year, and so she's back. So we are doing a 3-vector lift with 2 jawline threads for this particular patient. And so this is the treatment plan that we came up for her. Of course, every patient is going to be different depending on their anatomy and what their goals are and what really are the deficits that they're concerned about. For this particular patient, it's just overall skin laxity that we're trying to improve. And so that is why we selected the 3-vector with 2 jawline threads to try and get that jowl to pick up a little bit in the lower face. So just to run you through the procedure itself, we are using a blunt tip cannula right now to provide anesthesia. It's local lidocaine, so that way the tract in which we're going to place the thread is nice and numb. It is a blunt tip cannula, so you saw initially I was creating my pilot hole with an 18 gauge needle. And now, as I said, we're going to anesthetize these tracts where we're going to drop our threads in. In addition, it also sort of paves the way for where you're going to place the thread. It ensures that you're in that proper depth so that when you go behind it with the actual thread itself, it just sort of slides in quite easy because you've already paved the way for that thread. And so we're just getting her numb at this point. Generally, I like to tell patients, that pinch and burn from the lidocaine is sort of the worst part. And then from there, they don't feel much more than just some little bit of tugging and pressure because they should be overall fairly numb. So we're just about finished providing her anesthesia. You can see I just took my left hand just to confirm her anteguinal notch. That is the notch in the mandible where that facial artery is coming through. Of course, facial vein as well, but the facial artery where I want to make sure that I am a safe distance from that facial artery so that we don't hit it with our thread. We are going to be using an L-shaped thread. You can see perhaps on the camera, an L-shaped is the one side of the cannula is sharp and then the other is flat and dull. And so this tends to lead to less bruising and swelling because you're not coming through with like a very sharp 18 or 19 gauge needle. So in this case, we are using VSoft lifting threads, and I have selected a 17 gauge 100 millimeter in length cannula or thread for this particular patient. It is known for being one of our stronger threads, and given that this patient lives a pretty active lifestyle, I want something that's really going to, give her the most collagen and the most lift possible, and she certainly has the tissue to support it. I would never consider using a 17 gauge in somebody with thinner skin or perhaps an older patient who has that sort of delicate looking tissue, but this patient has the tissue to support and, if you will, disguise this thread. It is a pretty big thread, as you can see, and so if they have that thinner skin or that very pale skin, the concern is that you could potentially see the thread through the tissue, and that's obviously something you'd want to avoid. So I felt that this was an appropriate selection for this particular patient, and this is what we used last year as well, and she did really well with it. You can see as I'm removing my thread, I'm really exaggerating my lift. And you're just trying to sort of tack that tissue up on those molded barbs or cogs to exaggerate your lift. And so we're coming through now just straight down to the jowl. That is one of her main areas of concern, is the lower face. And here we go with removing it as well. You can feel that thread literally engage on the tissue. Okay, so our 3-vector is complete, and now we're going to move on to the jawline. I am using a Lido with Epi to numb her pilot site, so you might see a little bit of blanching at the entry point, and I like to use that because it tends to produce less bleeding at your entry point, which sometimes can make it more difficult to place your cannula on your thread. So we're going to just numb the jawline as well. You can see that this slides in really nice and easy once you're in the appropriate plane, which is the subdermal plane. And now we're going to go ahead and move on to our thread. And as you can tell, the patient looks quite comfortable. She doesn't really feel too much during this procedure because we did numb her with the lidocaine. And I always let them know if at any point you're uncomfortable, just let me know and I can give additional lidocaine. I would just use a Comfortox needle and just inject in the area that they're having some discomfort. I will say around the mouth, around the ligaments around the mouth can be fairly uncomfortable for some patients. And so I find that if and when somebody were to need additional anesthesia, it might be toward the mouth when you're coming through some of those ligaments. But most patients do quite well with this. We're placing 2 here just for additional support. I have one just going, one just right above the other. And now we're removing. Okay, so what you just saw there was a thread did not engage into the tissue, which sometimes happens. It's not very often, but sometimes it does. In the event that that occurs, it's really no big deal. You just go ahead and drop another thread. What happened was the thread just must not have caught the tissue on the way out. And so you can see here, I just took a brand new thread and I put it in right behind it and it engaged as it should. So nothing to ever be alarmed about. It happens fairly infrequently, but just so you're aware, you could see as I removed that needle that there was not a second thread coming out of that port. And I could feel in my hands too, I could feel that it hadn't engaged as I was pulling. With lifting threads, you never want to pull back if you're planning to advance forward. Because what happens is sometimes that tissue can engage on the thread, and then if you advanced forward, then you're going to get an overlap of that thread, which can look a little bit bulky and might appear on the outside of the tissue. You'd be able to see they have like a little bit of a bulky spot. So now we're just going to trim the threads. As you can see, I trim the threads a little bit short. That way the tails of the thread tuck right under the tissue so you cannot see anything on the exterior. And now comes just a pretty big massage. I like to make sure all the threads are engaged appropriately. At this point, you feel a lot of clicks, and that's just those barbs catching onto the tissue for the lift that we're looking for. So we'll cover her up with some Band-Aids, and we'll see her back in about 4 weeks for a follow-up once everything is healed and all of her swelling has gone away. We teach PDO lifting threads at the AAFE several times throughout the year, and we hope to see you at a course soon. This is truly a procedure that I love and could not live without in my practice. It offers so much for patients that we can't really attack with just Botox and filler alone. Thanks for watching.